I am Ramaswamy Govindan, a medical oncologist, a professor of medicine at Washington University in St. Louis. So for patients with stage 3 or locally advanced non-small cell lung cancer, how do we decide what chemotherapy regimen to use when we begin to treat them, along with radiation treatment? In the past, we used to give chemotherapy once every 3 or 4 weeks, and then radiation would go every day from Monday through Friday for about 5 to 6 weeks. And we used to use a combination of this chemotherapy regimen called cisplatin and etoposide, given over 5 days and then repeated every month or every 28 days for 4 times. And radiation will begin with the first day of the first cycle of chemotherapy and will overlap first 2 rounds of chemotherapy, since radiation therapy is given over 5 to 6 weeks. It is a regimen that has undergone multiple testing, multiple clinical trials, and widespread use. Cisplatin can cause some problems with the kidney function, can cause neuropathy, can cause difficulty in hearing. Over the past 20 years, we have moved away from that to use more and more a combination of 2 drugs, paclitaxel, commonly known as Taxol, or carboplatin and carboplatin. This combination of Taxol and carboplatin is given on a weekly basis during the administration of radiation treatment. That's about 5 to 6 weeks. It turns out that this weekly paclitaxel and carboplatin is much better tolerated with fewer side effects and very few problems related to kidney functions. And later on, trials done in the late 2010, 15 really showed that this regimen produces comparable results compared to the previous ones. And these days, with the arrival of immunotherapy, we feel that this regimen is much better tolerated before going into immunotherapy. I have moved over completely from giving this monthly chemotherapy regimen to the weekly chemotherapy regimen that's much better tolerated. I suspect that that is the most commonly used chemotherapy regimen, that is weekly paclitaxel carboplatin along with radiation treatment, and that is what is used commonly in this setting. There's also one other chemotherapy regimen with a combination of pemetrexed and carboplatin. Pemetrexed goes by the commercial name Alimta, and carboplatin that's given once every 3 weeks. Pemetrexed is a drug that is reasonably well tolerated by most patients. And so that really became a focal point of research a few years ago. My colleagues and I have conducted 2 large studies and looked at this combination. We compared with a more time-tested old chemotherapy regimen, cisplatin and etoposide. We didn't find this to be provide any big advantage. This was a bit of a surprise to us because we all thought pemetrexed was much better tolerated, but it turned out to be the side effects were identical. And so while these 3 regimens are used more or less throughout the world, the cisplatin and etoposide given over 5 days, repeated every month for 4 times, pemetrexed and carboplatin given every 3 weeks over 4 times. And then the weekly paclitaxel carboplatin during the 5-6 weeks of radiation treatment. These 3 are the commonly used regimens. I don't think it makes a big difference. I think I would go towards the weekly paclitaxel carboplatin with radiation simply because it's a lot easier for the patients, and really there is no big advantage in giving the other 2 regimens.